A blind woman sees with tooth in eye surgery. Doctors in Florida restore a woman's sight by implanting a tooth in her eye.
That's different.
No, but I think that's how they do it.
Warning. Some viewers may find the following video disturbing. Viewer discretion is advised. He was 13, playing in a basketball tournament. Felt a little off, so he did what anyone would do. He took 2 ibuprofen and went to bed. He woke up in a hospital a month later. He'd been in a coma. His skin had been literally peeling off his body, and when he finally opened his eyes, he couldn't see. He was completely blind. For the next 20 years, OK underwent more than 50 operations trying to get his sight back. 50. None of them worked. Then, in 2025, his surgeon called him with a new idea. They were going to pull out one of his teeth, drill a hole through it, fit a lens inside, grow it in his cheek for 4 months, and then implant it into his eye. He thought the doctor was joking. The 2 ibuprofen tablets triggered something called Stevens-Johnson syndrome. It's one of the most catastrophic drug reactions in medicine. The immune system, instead of attacking the drug, attacks the body's own mucosal surfaces. Skin, eyes, mouth, airways, everything that lines the inside and outside of you. In severe cases, which this was, the skin separates from the underlying tissue. The corneas, the transparent front surface of each eye, become collateral damage. The immune system scars them from the inside. The scarring is permanent and progressive.
I'm blind in my left eye and 43% blind in my right eye.
And because the corneas are now being treated as foreign by the body's own immune system, standard corneal transplants get rejected immediately. The fundamental problem is immunological. The ocular surface, the conjunctiva, the cornea, everything at the front of the eye had been permanently reprogrammed by the Stevens-Johnson reaction to attack any foreign material. It didn't matter how good the transplant was, the surface would destroy it. What he needed wasn't a better transplant. He needed something the immune system would never recognize as foreign. The procedure is called osteo-odonto-keratoprosthesis, or OOKP. It was invented by an Italian surgeon named Benedetto Strampelli in the 1960s, over 60 years ago, and most people have never heard of it. Here's what actually happens and why it works. A canine tooth, the long pointed one, is removed from the patient. Not a donor tooth, the patient's own tooth. This is critical. Surgeons then cut a thin lamina from the tooth and root structure, creating a small flat plate of living dental tissue. They drill a precise cylindrical hole through the center of this lamina and fit it with a small optical lens, essentially a tiny telescope. Now here's the part that makes this work biologically. That tooth lamina, with the lens inside it, is then surgically implanted into the patient's own cheek. It sits there for 3 to 4 months. During that time, the cheek tissue grows into the tooth structure. Blood vessels penetrate it. Connective tissue envelops it. The body fully integrates it as part of itself, because it is part of itself. When the lamina is finally removed from the cheek and implanted into the eye, the immune system does something it refused to do with every synthetic material for 20 years. It accepts it, because the immune system looks at that tooth lamina and recognizes it as self. It has the patient's own HLA surface proteins. It has the patient's own tissue markers. It is genetically identical to every other cell in that body. The immune system has no reason to attack it. The lens inside the tooth now sits in the center of the eye, creating a clear optical pathway from the front of the eye to the retina, which in OK's case was completely intact and had been waiting 20 years to receive a signal. For the first time in 21 years, light was reaching his retina, and his brain was processing it. Over the following months, his vision improved steadily. He can now read. He can walk unaided in unfamiliar environments. He can see faces. Strampelli published his first results in the early 1960s. This is not new science. The immunological principle, use the patient's own tissue to bypass rejection, has been understood for decades. And yet most ophthalmologists in the world have never performed it. Most patients who could benefit from it have never heard of it. It's performed in fewer than 20 centers globally. Why? Because it's extraordinarily complex. It requires an ophthalmologist, an oral and maxillofacial surgeon, and months of staged procedures. The cheek integration phase alone takes 4 months. The surgical time is measured in hours across multiple operations. And the patient pool is narrow. It only works when the retina and optic nerve are intact, which rules out most forms of blindness. But for the patients it does work for, the ones with destroyed corneal surfaces from chemical burns, autoimmune reactions, Stevens-Johnson syndrome, the success rate is striking. Over 90% of patients retain functional vision, and that vision can last 30 years. Stevens-Johnson syndrome affects roughly 1 to 2 people per million per year. The risk from ibuprofen is real, but extremely rare. This is not a reason to avoid common painkillers. 60 years of medical history. 1 tooth. 21 years of darkness ended. Stay safe. I'll see you next week.